Hi guys, I'm gonna wait a couple of minutes to make sure everyone who needs to be here has come. I know it might take a little time. We've put it at 11 o'clock, but obviously people have other things going on. In the meanwhile, it would be great if, in the chat box that we have on the side, whoever is here can just say what country they're coming from or what stage they're at right now on the road to UK, just so that I can get a feel of my audience. I'm gonna be looking down every once in a while because I am running this on two computer screens. And I have my notes in front of me to make sure I don't go off topic. So I'll try and keep as much eye contact as possible and answer any questions that I see occasionally on the side. But yeah, in the meantime, let me just introduce myself. So if you all know me already, that's great. My name is Breeze. I work as a doctor in the NHS. And this August, I will be starting in internal medicine training. This is a new thing that will take over core medicine training, which basically was the way you could get into medical training and then later on into specialty training up until now. And it used to just be 2 years. But from August 2019, this coming August, it's become a 2 to 3 year process. And I'll explain that a little more in a bit. But basically what I intend on talking about today is the essential outline of how IMT will work, your general person specifications, how you can apply, what you need to apply, what your eligibility requirements are, how you can make a really good portfolio, what you can expect in the interview, how to really, really nail the interview, and then the preferences and the ranking system later on so that you can get the offer that you want. Okay, so that's great. I'm seeing a lot of people are turning up right now from Nepal and India. Fantastic. Well, this is good. So if, let's see, we've got about a minute in. I can get started if everyone's fine with that. But let me just start off by talking about the most important thing. Before you can even think about internal medicine training or working in the United Kingdom, you need to make sure you get GMC registration. So how that works are there are 3 essential ways that you can get GMC registration. That's plab, an accepted postgraduate qualification such as MRCP or MRCS, and then finally by the Medical Training Initiative, or MTI. So most of the time, people will come by plab if they're fairly fresh graduates, mainly because it's less expensive, it's not as difficult as an exam, and it doesn't take as long versus some of the other processes to get into the UK. So if you take the plab route, which we've extensively talked about on our site, you can see that you'd basically be starting at a lower level junior doctor post, like an FY2 or a CT1, and these are usually non-training posts, though you can find training standalone posts for FY2s. So you can do that for some time, or if you come via the accepted postgraduate qualification, like MRCP or MRCS, you need to complete your MRCP or MRCS completely, all the steps, and then you can apply for GMC registration. Now, for plab, you need to have cleared IELTS or OET beforehand before you're allowed to sit for the plab exam itself. But for MRCP and MRCS and everything, all the other postgraduate exams, you actually can take the exams and then clear IELTS or OET because the IELTS or OET is just needed for the GMC registration. So sometimes if a person feels that, it might take them a while to clear IELTS, they decide to go for a postgraduate qualification, and that's fine. With MTI, how that works is essentially you are being sponsored. So it's pretty strict to get into MTI. I wouldn't recommend it if, you aren't very sure that you're meeting all the qualifications and requirements necessary for MTI. You can't have any gaps in your career at all. And you need to have some form of post-graduation done, be it MRCP Part 1 or a MD degree or an MS degree. And then you're becoming on a Tier 5 visa, which you can then later switch to a Tier 2 once you get a job in the NHS. But essentially, it is a good stepping stone if you maybe want to finish the rest of your postgraduate exam. Like if you've only done, MRCP Part 1 and you want to do PACES in MRCP Part 2, some people like to do MTI so that they can get an idea of how the UK system works, and then they enter into working in the NHS. Okay, so it looks like more people have turned up. So I'm going to talk about the eligibility requirements essentially for IMT from now. I just want to double check with everyone that the audio is fine. Can everyone hear me okay? Just let me know, and we'll start from there. So essentially, I'm going to talk about how I got into IMT. So I did plab because I was, a fresh graduate. It didn't make sense for me to work and do MRCP first. So if you've already done MRCP, I see there's a question about that on the side. If you've already done part one, it's not a bad idea if you want to go ahead and do plab and then get your registration via plab, because it will take you a little bit longer to do the rest of the parts. And if you are otherwise fully dedicated to the plan, having your part one of MRCP done is an advantage for you. It helps a little bit in your job application, and you don't have to worry about that later on once you get into training. So what I did after I completed my internship and I finished plab and I got GMC registration, I went ahead and I found a non-training job in the United Kingdom. And my post was a CT1 level post. I know a lot of times, we're a little concerned, should we take a post at that level, especially if you're not really sure about how the UK works and everything. But I went through the person's specifications. I was fairly confident. And I even talked about in the interview, in case I need any help, would there be support? And I was, reassured that if at any time I need anything, that's fine, there'll be someone. And because I started in A&E is an extremely supportive department. There's never a time there isn't at least a registrar on the floor. During the day, during normal hours, you will find a consultant at all times as well. So that's just my plug for A&E. If you are wondering where to start, A&E is a fantastic place to start. It is very fast-paced. There is pressure, but I was able to get my competencies, my FY2 competencies signed off very, very quickly because every day I was doing something. I was doing a cannula or maybe, catheter or putting something somewhere that I needed to do to sign off on my competencies. And in 3 months' time, I was able to get it done because there's always something to be done. Not to, to take away from other departments, but when you think about how the system is, patients go from A&E to the ward. So if everything's already done for the patient once they get to the ward, it's very unlikely you'll have to redo it unless for some reason something's happened to that patient's cannula or they need a catheter later on or anything else needs to be done later on. Okay. So taking from that, once I started working in the NHS, my goal was to apply for IMT as soon as the applications became open so that I could apply for it. So if you have that goal in your mind that this is what you're going to do, it's really good because then you can stay oriented towards what you want. Some people think, okay, well, if I do this, if I do that, and that's fine. But you need to find one thing and stick to it. If you want to go into surgical training, go into surgical training. If you want to become a GP, be a GP. If you want to be a pediatrician, be a pediatrician. It's difficult, I know, sometimes if you're not sure where you want to go, but whatever it is that you set your mind to, just go ahead and stay with that rather than kind of dilly-dallying about should I do this, should I do that, and then you've wasted a lot of time. So I'm not eligible to apply for round one since I don't have a settled visa status in the United Kingdom. So round two applications opened in February 2019. So in that much time, basically what I was doing was every little thing that I could to make sure that my portfolio was very, 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 very sharp. And let me just pull this up so I can get you guys to kind of see what I mean by that. So just 1 second, I'm just going to pull up our information about it. So if we go through the categories that we have here, we're just going to hop on down to IMT. Okay, so we've got the whole series written out for IMT. Basically, the general guidelines are prepped for your portfolio, for the interview, and for later on your preferences and your offers, or your offer, I should say. So let's start off with planning your portfolio because there is something important here that I kind of want to make sure everyone understands. Okay, so I've kind of talked about this already, where to start out, but here's a really important thing that you need to understand. These are the points that will be looked at when you are making your portfolio, okay? When you're submitting your application, to Oriole, they're going to look at if you have any undergraduate degrees or qualifications, anything postgraduate, any achievements or prizes that you've made or gotten, any poster presentations, publications, teaching, training and teaching, any quality improvement programs, and leadership and management. So if you are someone who is applying to IMT and you've already completed, let's say, an MD, or maybe you've done some sort of bachelor's degree as an undergrad, these can add points to your application. Your overall IMT score is comprised of your application score and your interview score. So while the application does not have as heavy as an influence as your interview score, that doesn't mean you shouldn't still put a really good application together and a really good portfolio to get together, because it does play a part. There is a station in the interview that is about your portfolio. So what I really want to emphasize is if you have any sort of undergraduate or postgraduate degree, these can give you some points, but they aren't necessary. I do not have any postgraduate or undergraduate degrees, and I was still able to get into IMT. But like I said, don't think they are necessary. Sometimes we get a little confused about the requirements of academic degrees and that of basically the clinical degrees. So don't be too into that. And then additional achievements or prizes or awards, perhaps in medical college you've got any awards, that can be mentioned here, any poster presentations. Whatever you mention here, please make sure you have proof. Okay, please make sure you have a proof of whatever you're talking about, because it won't mean anything if you just say it and then don't actually talk about it. All right, and then basically the publications, any teaching experience you might have, try and provide feedback, quality improvement, all that good stuff. So let me just switch back to this, because what I want you all to see now essentially is how I put together my portfolio. Alrighty. So what I have done, there are some requirements for the portfolio that you need to keep in mind. You need to have a lever arch folder like this. This is my lovely portfolio. Okay, I'm just making sure that it has the video caught up. I'm not making sure there's not a lag. Just one moment. Alrighty, there we go. I think the video's caught up now. So this is my portfolio. This is the portfolio that I submitted when I did my IMT application. So this is an arch lever folder. It can be whatever color you want it to be. There aren't any requirements for colors. I just don't get anything that's too, unprofessional. Let's be straight. It shouldn't have like a dragon or a unicorn on it. They might not take too kindly to that. So how it's basically broken down, what I did, and this was just my doing, you don't have to do this. I went ahead and I put different sections spelled out, because at the first part, you're going to have a general kind of outline about all those topics that we mentioned and what pages they're on, because when the interviewers will sit there, they'll go through your portfolio, they won't have a lot of time. They need to know exactly where to go and how many points you've given for yourself for those things. Okay, so what I did was, if you just see here, I've gone ahead and I've put little tags on the side, page tags, and I've written page numbers. I know it's very tiny, you can't see that very clearly, but I've put what pages everything important is at so that they could quickly go there. And I just thought that would make their life much easier. And of course, if they can find the points that I'm talking about, they will give me those points. So for instance, for my teaching experience, let me just open this. Okay, so just an example of what you can do. While I was working, what I did was in my A&E department, I held a little talk about seizures and how to approach seizures. And this is what I did with my peers and my colleagues in the A&E department. We would have teaching 2 times a month. So I just asked my consultant, could I please do a teaching? And he was fine with it, obviously. I had a PowerPoint presentation where I talked about, all the things that I did. And then with that, I took feedback from everyone. So my trust gave the feedback sheets. You can just ask your trust about it as well if they have a feedback form that you can complete. And then I just asked for photocopies of all of these feedback forms so that I could put it in here to prove that I had actually done the teaching. Okay, so that's for teaching. And then let's go a little bit further. I did several teachings because you want to show that you're talking about different topics. And I made sure all of them were medicine related, even within A&E, because A&E itself, while being a medicine subject, you see surgical things, you see orthopedic things, you see pediatric things. but I wanted to make sure my portfolio was heavily medicine because they're going to ask you otherwise in your interview. Then why are you applying to IMT? All right, sorry, let me just flip through now to the next section. So I really didn't have a lot as a fresh graduate, on my own to provide. So everything I did was in the span of the few months that I was working in the NHS as a non-training doctor. So the next part is my quality improvement, which is also very, very important. Most of us do not have anything like quality improvement back home or auditing. So when you come and you start working and you hear people talking about, oh, I need to do a quip, I need to get this quip done, you're like, what is it? What is a quip? That's basically what it is. It's a quality improvement project. And essentially, if you can't think up something to do, you will find a department. There's an audit department. There's a clinical governance department in your hospital, in your trust. Go talk to them. Ask them, is there anything currently running that you can join? Or if they have any ideas about things that you can do. And then you just kind of go from there. They give you a form, you complete that form about what you want to do in the long run and how you want to improve it, and then, you're set. But you have to make sure you do all the things. Like, for instance, I did one in A&E about the indications of abdominal x-rays. And this is my full, documentation of everything I did. I collected data, I did the analysis, I put together a report, and then I presented it with my action plan. And I presented it in all the relevant departments, which is also very important because it shows that you really wanted this audit to be recognized and listened to. It's not that I just did it for the purpose of my portfolio. Okay. And I also provided the slides of my audit in the portfolio so that they could see everything that I did. And please, please, please make sure you understand your audit. And I say this because in the interview, they will ask you about your audit. They will ask what happened, why did you do it, what did you intend to do with this audit, and what did you want to gain from the audit. So make sure you know everything that's there because they do have it in front of you, in front of them. So you're not looking at it, so you should know what you're talking about. So I did several audits, and that's up to you. You don't have to do more than one if you don't want to. I just had the opportunity to do a couple, so I went ahead and did them. The next section is your commitment to your speciality. And this is very important too, because, sometimes people think, well, let me just do IMT as a stepping stone because, maybe it's really easy to get into, and then I can apply into round one for some other training the next year. I wouldn't really suggest doing that, mainly because, you're taking somebody else's seat that perhaps really wanted to get into IMT. One, two, there's not always a guarantee that if you apply in round one that you'll get into it in round one. Like, for instance, core surgical training is extremely competitive whether or not you're an IMG. I have some friends who are trying to get into core surgical training who are British graduates, and they are, in tears over how stressful it is and how difficult it is. And a lot of times, a British graduate still won't get in because it is a very competitive speciality. So I just want to kind of emphasize here that applying into round one doesn't always mean an easy ticket into getting into that training. Yes, there is an advantage because, if there are not any seats left over, you at least are weighed beforehand. But don't think that just because you're applying in round one, you'll automatically get in. So for my commitment to speciality, basically I talked about that I have plans to take MRCP, that I really want to do these things, that, in the medical field. I had some extra stuff that I put in there, like I attended the RCP, the Royal College of Physicians Conference on Medicine, because I just really wanted to see what was going on there and, kind of solidify my foundation as a doctor, or at least a medical doctor. And then the last part, which is really your place to brag, is your achievements outside of medicine. And this is a place where you can really talk about some good stuff that you've done that you think that they would be really interested in knowing. For me, I just put a little bit about the stuff that I've written in the blog and the video series that we're doing, which is something that I mean, it's my passion. Definitely, I didn't think about it when I put together the website that I could even put into the portfolio. It was actually when I started putting it together, and then I was talking to my educational supervisor about how to put together a really good portfolio for IMT. He mentioned it, and I'm actually really glad that he did because it was a good talking point in my interview, and I definitely think I scored a couple of brownie points just based on some of the stuff that's been done for the site, and basically the majority of it comes from you all being there supporting us along the way. But the last bit And the last bit that I really think seals your entire portfolio and makes it really strong to show that this is what you want to do is your training courses that you attend. Now, everyone thinks, okay, well, I know ALS is mandatory and I have to have my ALS done beforehand, before the start of your training. And yeah, that's true, but ALS shouldn't be the only thing that you do. And the reason for that is because when you think about it, all right, most of us have done BLS back home. And BLS it's called basic life support. It's very, very basic. And then you're going to advanced. And no one's done anything in between. So sometimes it's a bit of a shock when you go from BLS to ALS. So what I did, aside from I did ALS, of course, because you need to have that done. And I thought it'd be better I get it done beforehand so I can show that I'm, committed. I also did immediate life support, ILS. And it is that little bit of a break between BLS and ALS. And I did it before my ALS, and I would highly suggest and recommend that you all do this as well, mainly because I don't think I would have passed ALS without ILS. I was doing nights when I had my ALS, so I was already slightly frazzled. And you really can't, change around the dates because they're very limited. But I had just done ALS the week before, and it was still pretty fresh in my mind. And then I was revising, and I went for ALS, and thankfully I passed it in one go, which was stressful on its own. But ILS is available on Resus UK. A lot of trusts also offer it in their hospital. My trust offers ALS and ILS. So I went ahead and I took advantage of it because ILS was free within the hospital. I didn't have to pay for it. So beyond that, there is another really good thing called Alert. Alert is, think of it as BLS 2.0. It's something that everyone has to do. Healthcareers, nurses, doctors, physicians, assistants, everyone. And it basically kind of emphasizes how when you see a patient on a daily basis, what are the signs and things that you should recognize that this patient is deteriorating so you know how to escalate and then further manage. This is also provided by my trust, so I went ahead and did it because it was provided, and it was a really great learning experience. I definitely think that you should do it if you have the chance. Another thing that I did was I did a leadership course. Make it on here, yeah. A leadership course, and I added that to, if you remember earlier when I was showing the breakdown, there was a part about experience in leadership and training. So it's something that you can do if you look within your deanery. On Max courses, you can see they have one free course for this, and it's called, let me see what exactly it's called. It's called Leadership for Doctors and Advanced Clinical Practitioners Early in Their Careers. It's a very long name, but it is a full day course. I went to it in New York. It was the nearest hospital that held it, and it was fantastic. I learned a lot about what my role is in the NHS and in my department, and how I can basically work to improve myself and talk about how I feel as a junior doctor, and when I know, it's important to speak up, because sometimes when you're a new doctor, you feel kind of tentative to say something if the registrar says to do something or the consultant says to do something, and you don't necessarily feel comfortable. So it's a very good idea to attend this kind of a course if you're not sure about what your role is and how you can kind of gain some confidence as a doctor in the NHS. Another thing I did in my A&E teaching, we had, I keep forgetting the camera's the opposite way, is on fascia iliaca blocks. That is a little bit more surgical than it is medical, but I thought I'd still add it in because it is still showing that I'm trying to, improve myself and learn. I did a couple of other things. I don't want to go through every single thing I've done on here, but basically, if I had to summarize how you could really find out about courses without breaking the bank, the easiest thing you can do is if you check in your hospital's website, in your trust's website, they'll have a hub where they'll have course bookings, and those are all free. So sign up to as many as you can. You get study leave for them if it's a full day. If not, there might be, a half day or something. Then that's fine. You could just do whatever you want that you think is really, really useful and interesting. For me, basically, besides these, I did some courses on how to do ABGs or arterial blood gases, how to, after you do the ABG, how to use the machine to read if the bloods are acidotic or alkalotic. So that's basically, I think, everything on portfolio. Let me just see if there are any questions. How much of a gap did you have passing plab 2 and start training and applying for IMT? Oh, so what I did after I completed plab 2, I got a job fairly quickly. As soon as I passed plab 2, I started applying for jobs, which you can do. There is an option for that on the NHS Jobs website. And I did tell them that I was in the process of applying for GMC registration. But I got the job before I got GMC registration, so it worked out in the long run because I had to get some paperwork from home and everything. But then I started working as soon as, I was able to. That wasn't an issue in that sense. Okay. All right. So if there are any other questions about the portfolio, please let me know now and I'll talk about them. Otherwise, we'll start talking about how the interview works. So basically, after you've submitted your application in Oriel about, for internal medicine training, you will have a bit of a time gap where they will tell you if your application's been accepted. So other things that, I forgot to mention about your eligibility before I forget. You need to have completed 1 year besides your internship before the intended start date of your training. Now, let me explain what that means. I have not been working for 1 year in the NHS, and I don't have any other work experience that I can add on to that. So I need to have 1 year by August, which I will. I will have 1 year by August, which is why I was able to apply. If you are, let's see, you've got 6 months from home, your home experience, not internship. After internship, you've done 6 more months, and you do 6 months in the NHS, that equals to 1 year. That's fine. They're happy with that. It just needs to be 1 year postgraduate experience after internship in order to apply. That's part of the eligibility criteria. Please do not apply if you do not have that 1 year. There has been some talk about, people who have done that. But the thing is, when you submit your application to Oriel, it asks you at the bottom, everything that you've submitted, is it true into understanding of everything that's been mentioned here? And it asks you beforehand, when you submit, are you saying that you are eligible in the sense of all of the requirements set out by this application? If you are not, and you say you are, you can get into a lot of trouble, and it's not worth risking. Just wait for the next year. This isn't a race. I know a lot of us get stressed out. They're like, oh, but I'm really old, or I feel that I'm really old, or time's running out. I know so-and-so when we were classmates and they're already somewhere else. Don't think about all of that stuff, because that's not how it works in the NHS. It's more about enriching your knowledge and your ability to be a better doctor rather than just kind of running towards something. Okay. So let's talk about the interview. So I'm going to go back to the website really quick just to show you how our rundown is for that part. Alrighty, so back up to categories and run on down again to our separate section. There we go, sorry, didn't click categories. Alrighty. Okay, we're coming on down. And here we are. All right, so now we're going to talk about the interview. So what I really want to first talk about before we mention anything else is how the scoring system is, because it can be a little confusing. Get that to open. Okay. Through here and the interview. Okay, so let's first talk about how the interview is marked and everything. If you just see what I've pulled up, you're gonna have 3 stations essentially, and in these 3 stations, you're gonna have 2 interviewers. All right, they might ask you questions at the same time, they might split the time between themselves, but essentially they're 2 people and they're going to be asking you questions, okay? So the way it works is there's gonna be a scale of 1 to 5 and you will be graded on that. 1 being the lowest, 5 being the most, and then they will put together all the six aspects that I'll mention a little bit below about what they're looking for, and you're going to be looking at getting 12 marks total, all right? So if you were to get all of the marks that you could potentially get at the end, you would have a total of 60, and this is your raw interview score. Okay, so this interview score will then be multiplied by a weighting system, which I'll talk about in a little bit. But basically what you need to keep in mind is how you know you are appointable after this interview. All right, this is something that's very, very important. You can already get into, you've been shortlisted, you've been longlisted, you've been invited for the interview, but now the concern after the interview is whether or not you have obtained the right to proceed beyond the interview stage. So if you see here, to be classified as appointable, 3 criteria need to be met. None of your interview scores out of the 12 scores can be 1 out of 5, so you can't score the lowest essentially. No more of these can be more than 2, no more of these 2 can be 2 out of 5, and your raw score has to be at least 36 or above. So then after that, they have a weighing system, and that's how basically they kind of come to your total score. Okay, so I just want to talk really quick about the scores so you can understand what it means. They take this total score then and they add it to your application, and then we'll talk about that in a little more in ranking. But let's kind of go back to how the interview itself will be structured. So you'll be given you'll be sent an email essentially that will tell you that interview dates are open. And you can see your location and the dates that you can apply for, to go for these interviews. They're in several locations. They sometimes change. But this time, if I'm not mistaken, the available places were Leicester, Newcastle, Cardiff, London, Cambridge. There might have been some other places that I can't remember, but these were the places essentially that you can expect to go. So once I found a date that was, workable for my schedule, what I did was I spoke to my rota coordinator and I applied for special leave. It's a form of professional leave, and it's for interviews. You're supposed to get this type of leave for your interviews. You should not be taking annual leave. This is not annual leave. This is your right to attend this interview. So it should be a form of special leave or professional leave. So I went ahead and applied, and then when I thought about, all right, I have to get to the exam center, let me see what time, I chose a date that worked for me. I chose a location that worked for me. I chose a time that worked for me. And I got there about an hour early because I think my interview was something at like 10:30 in the morning. I got there at 9:30. They tell you to get there at least half an hour ahead of time, but I'm one of those people that I might get lost or something might happen. I don't know. I'd rather get there as early as possible and sit there and then be stressed sitting there rather than be stressed looking for where I have to be. So you get there and they'll tell you what things to bring. Essentially, you'll need to bring your passport as your identification. They ask for a photocopy of the page that has your photo and some other stuff, and you'll have to bring a printout for for your interview, the saying that yes, I'm having my interview today. So you'll sit and they'll go over all these things. It's like a mini ID check, which I'm sure all of us have had by this point. And at this ID check, essentially, they go over the rules again about what you can expect at the interview and what you should and should not do. Basically, do not talk about the interview, do not talk about the stations, do not talk about the questions. It's a matter of probity, and they discuss GMC's good practice with you. So please do not do any of those things. You are risking your GMC registration, and it's not worth it. Okay? Beyond that, then they ask you to sign at the bottom of the document that, yes, this is what you've done, this is all the documents you submitted are correct, and they take your portfolio. After they take your portfolio, you do not see it until the end of your interview. So you don't have your chance to really go over everything and study it, to prepare yourself for that part of the interview station. So make sure you've already done that before you come. I would also suggest if you have to travel a bit to get to your interview location, please go the night before. There's a place, at least where I went, they had a place for people who had a lot of luggage or bags. Just call the center ahead of time and ask them if it's fine, just like for plab 2, how you asked if you can bring your luggage and stuff. They're not going to be really finicky about it, but it is a good idea to just ask beforehand. So you go, they give you a little ID badge, that's your number, that has all your information on it, just like plab 2, and you're called into the interview area. And there are going to be 3 stations, there are going to be 3 chairs in front of 3 doors. Okay, there's not going to be a rest station, so it's just 3 stations, but the entire interview process will take 45 minutes. You will get 5 minutes to sit in the chair and read a question for the clinical station and for the ethical station that'll be there. But for the portfolio station, you just kind of sit there for 5 minutes and look at your feet because there's nothing you have to read. They're going to be reading your portfolio inside, and when you go in, they'll be asking you questions. When those 5 minutes finish, they will tell you to go inside. So you knock politely, go in, introduce yourself, sit down, and the station starts. So we're going to talk about the portfolio station first. What essentially they will do is they'll have your portfolio in front of them, and they'll also have a little tab or a little computer where they'll be doing your marks. Do not look at that. Just don't look at that. Don't stress out about what they're putting, what they're typing, when they're pushing a button, whether you're saying the right thing or the wrong thing. Just be normal. Okay? So they can ask stuff like, oh, I see that you've done this audit, like I mentioned before. Tell me about this audit. Or tell me about your achievements outside of medicine, which you remember was a section in your portfolio. Or they might ask, why do you want to do IMT? Why do you want to join IMT? Sometimes you might answer this question as, well, I really want to be an acute medicine doctor. And they can easily just ask you, well, then why didn't you apply for ACCS training? Because ACCS training does give you a really good scope of acute medicine. And you don't have to do IMT to do acute medicine. You can go by ACCS. But if you get that question and you really do want to do IMT in the long run because you want to stay in that side of it, you can just as easily answer that, well, I might change my mind, but I'm definitely dedicated to medicine, and I really want to see how internal medicine's different rotations are and get a feel of the whole thing rather than just kind of be in a more peripheral aspect in ACCS. But that's just my advice. You don't have to say that. Whatever works for you, just say that. Don't try and memorize answers. Like, again, you can't fool them into giving when you give boxed responses that these are your genuine responses. Be very concise in what you're saying. You've got a minute or two. Just answer the question. Don't try and show them you can do everything. They have everything in front of them. They know what you've done. You don't need to, embellish or talk more about yourself. Yes, definitely sell your abilities, but don't drag it out. Okay? So your portfolio station will be 10 minutes long, and they'll ask you a couple of questions. You just need to be normal and answer those questions. It's nothing really to be stressed out about. But there is a book that I will link at the very end of this webinar that is fantastic in how you should approach. And we'll talk about it a little bit more because it's very useful even in your clinical and ethical scenarios, especially in your ethical scenarios. So when you're done with that station, there'll be a knock at the door, or somehow somebody will tell you that you need to move to your next station. So let's say that the next station is the clinical scenario station, okay? So in the clinical scenario section, what will happen is for the 5 minutes that you'll be sitting outside, you'll be given a little cue card and it'll have a question. You'll have to read that question. And when you read that question, that's basically what you'll be expected to explain inside. All right. So now a lot of times you want to know, well, how can I really prepare for this question? How can I really understand what I need to know and how I can, answer everything they want answered? The easiest way to prepare, if you're already working in the NHS, I would suggest you do on-calls on your rota. Most of us do basics because we're a little concerned about how we'll do as an on-call doctor. But what I would definitely tell you to do if you have the opportunity is to do on-calls, because you see a lot of different patients and you see a lot of different things, and it lets you kind of get an idea of what you need to do in these scenarios, because that's basically what they're going to be asking you, okay? So let me just kind of pull up this so that you get an idea of what you can look at. Right here, how to prepare for the interview. Okay, so if you're already working, like I said, on-calls is a really great way to know what you need to know. But beyond that, if you want to supplement your information, the Oxford Handbook of Clinical Medicine has a section of emergencies. Go through some of those emergencies like sepsis, stroke, diabetic ketoacidosis, any acute exacerbation of asthma or COPD. or any electrolyte imbalance. I'm just naming a couple, but there's quite a few here that you can go through and kind of just see how to approach. Always remember, always remember, the most important thing as a doctor when you come in to see a patient is A, B, C, D, E. Okay? You need to check the patient's airway, breathing, circulation, any disability, and expose the patient as appropriate. So definitely, I mean, we kind of forget these niceties when we start talking about a patient, and that can happen sometimes even during our plab 2 exam. You need to make sure that you are remembering all those little things that you introduce yourself to the patient, you explain to them that you're the doctor and that you're just going to see how they're doing, and then you want to assess them via A, B, C, D, E. All right? And make sure whenever you're talking about it, try and go, you don't have to go in depth, but try and at least hit the key points about what you mean by A, B, C, D, E. And if the examiner or the interviewer basically asks you anything further, they will tell you what else you need to say. Otherwise, just cut it close to, keep it short if they want to know anything else. The really most important thing, if you saw earlier when I was talking about how the marking system is, they want to know that you're a safe doctor. Do not try and do everything by yourself. Do not try and say you will do everything by yourself. You're not going to be anyone's hero by being able to single-handedly see the patient, do all the things, run all the tests, and then diagnose and treat. The important thing for you as a doctor, as a junior doctor, I should say, is being safe. So if at any time, they're asking you a question and you're not sure how to approach, or you're a little, hesitant to do something, what I would definitely suggest you do at that time is state that you need help, okay? That you will ask for help from your senior colleague or your registrar or any consultant, or if there's anything that you need done, that you could be like, oh, I'll have one of the nurse colleagues help me do this or do that. Make sure you remember that there are a lot of people working in the NHS. It's not just doctors. So make sure you remember the roles of all the people who are working and how they can help you in whatever scenario is presented to you. Okay? So after that, you might be asked at the end of that clinical scenario, once you've dealt with the patient, how you'll talk to the family or how you'll explain to the patient what's going on. So just, again, be a normal doctor for that kind of stuff and just explain what it is that's going on. But if you're still unsure, remember, you always have the choice to say that I need help. Okay, so that's the end of that scenario. That'll be 10 minutes. And what you'll do after that is you'll move on towards your final station, which would be the ethical station. The ethical station is, again, 10 minutes inside, 5 minutes outside. 5 minutes outside, you will be reading a scenario about something that's happened to someone. And I will, like I said, link below the book that I had mentioned before that has a lot of really good ethical scenarios and how to approach. And I'm sure some of you all will remember some of the stations that came in plab 2. A lot of those do kind of repeat. So if you have any notes or how you approached it then, it's not going to be any different. But basically, you go into the station and somebody will have you go through that ethical scenario. Perhaps they'll pretend to be that patient or that patient's family member, and whatever concerns they have, you need to alleviate them. So it's a good idea to know about, general guidelines and trust policies and anything like any big organizations that can help people like PALS or anything like that if a patient has a complaint or if they have any concerns about anything. And then basically the ethical scenario kind of wraps up with, sometimes they might ask you some things about how things work in your hospital to see if you know where you could get help or what you need to do in the long run. But as soon as your interview is done, you are asked to leave the area and you're given your portfolio back and you're done. You're finished. It's it. You're good. You've finished your interview for your IMT. They'll ask you to leave and you'll have to, return the ID badge and everything else. And essentially, until everyone's interviews are done, you have no idea how you have done or how you'll be scored or what your feedback is. So in the meanwhile, you'll be asked to put together your preferences and rank your offers and what posts you think you want to apply for. Okay? I am going to make this one question. I'm going to answer this one question really quick because this is something I want to talk about a little bit later on, but since it's already been brought up, I think it's good to just mention it now. So whether or not it's advisable to enter IMT without any prior working experience in the NHS. Okay, so the reason I'm kind of not for it is mainly because, like I said, in a lot of these stations, they will ask you about things that if you don't already work in the NHS, they're kind of gonna, it'll be difficult for you to answer if you've not experienced it. If you've done a clinical attachment, it might be, you might be able to answer those questions. Or if you know somebody and they tell you, okay, this is how the system works, you might be able to answer those questions. And then on top of that, once you start working in IMT, the thing you have to keep in mind is it's going to be a kind of stressful environment. You're going to be in a training post, okay? And since you're going to be in a training post, you don't want it to be that the first time you're doing all of these things is as a trainee. You'd rather it be that it's during a time where you already know what's going on and you can have someone to kind of feedback on and tell them what's happening and how you're doing. Not to say that you won't have any support once you join training, but I would definitely think it's a good idea to build up your portfolio beforehand just so you have some experience. But if you are joining IMT straight away, that's fine too. I mean, all power to you, but just, make sure you go in there with the notion in the back of your head that you need to be well prepared. Okay, so let's now talk about how preferences and the offer work in the long run. Alrighty. So, in the meanwhile, when you are waiting to hear back about your interview, you will be sent an email and told, all right, in this time, what we're going to do is we're going to let you know about all the different posts that are available in round 2. With all of these posts that are available in round 2, here are the areas that they're available, here are the rotations that they have, and here's what you can expect in your IMT if you choose to go to a certain place. Okay? So what you need to keep in mind first is about the location. Some people want to be in a certain area because they have family there, or some people want to be in a certain area because they know someone there, or that's the place that they want to live, and that's fine. But please remember that this limits your ability. This limits you a lot when it comes to the places that you can rank, because that area may not have a lot of places. So there are going to be 2 columns. If you can see here how it's kind of set up in this region. This region shows, for instance, Northeast, or for Scotland, how the rotations kind of look, what you can expect for IM1 and IM2, and which hospitals it'll be in. So it's really nice because you can know exactly where you would be rotating, what you'd be seeing, and which different departments you'd be going through. Okay, remember how I mentioned earlier about the ranking in the sense that it's going to be comprised of your interview score and your score from your application. So how you rank is very, very, very important, because if you don't get where you want to go because of your ranking, it's going to be problematic in the long run if you don't have any place to fall back on. So you will have 2 columns. There will be a column on the right and a column on the left, and all of them in the first place will be the column on the right, and those will be all the places basically that you don't want to rank, that you don't want to go there. For 100% sure you're not wanting to go there. You can also open it as an Excel if you are, you find it easier to view it that way, and you can choose to select by deanery or by area or by rotations if you really, really want to get into that. But in my personal opinion, you should just rank every single place that's available, because you want to guarantee your seat and get an IMT seat. A lot of times people ask, well, is the training any different? And it's not. Throughout the United Kingdom, they have a set standard of training. So whether you're training in Scotland, Wales, Northern Ireland, or England, it's going to be the same training. So do not have that as a barrier. The one thing you should keep in mind, though, if, for instance, you get your IMT in Wales, okay? And then you finish your IMT and then you want to apply for specialty training, you can apply in round 1 for specialty training in Wales. However, if you want to apply in England, Northern Ireland, or Scotland, you would be applying in round 2, because the visa that you are getting for your training visa, it's region specific. Sorry, not deanery specific. It's region specific. So you will be exempt from the RLMT initially for Wales if you've gotten your IMT in Wales, and the same thing applies if you get your IMT in Scotland. You can apply in round 1 of specialty training in Scotland. but not in round 1 for England, Northern Ireland, or Wales, and that applies for all of the regions. So keep that in mind. If you have decided where you want to do your specialty training, make sure you at least try and get your IMT there. That doesn't mean you can't get into round 2 of round 2 of your specialty training in a different region, but definitely it would be much easier if you got it to where you already were. So when you rank, personally, if you ask me, I ranked by the rotations that I wanted because I want to be a very good medical registrar. I want to have the rotations that I eventually apply to for specialty training. And for me, that was more important than location. I did look at location too, not to say that I didn't, because I wanted to be in a town that I thought would be, it had a little bit of hustle and bustle. It would be a change for where I currently live. It had something new or exciting to see. But don't let that be the only reason, because I know everyone will be like, oh, I'm going to rank London number 1, and I'm going to London because London, everybody wants to be in London. Okay, but the thing is, London doesn't have that many seats in round 2, 1. 2, you might not get the rotation that you want. And if it's really important for you to live in an area, you have to then sacrifice your rotations. And that's not something I would, again, my personal opinion, want to sacrifice, because it's your training, and you want to be able to be trained in a lot of things that kind of make you a more well-rounded medical registrar when you start your specialty training. Now, if you're not able to find the rotation that you want, for instance, let's say you want a rotation in palliative medicine, and you've looked through every single preference and there is no preference that has palliative medicine. That doesn't mean you can't apply for palliative medicine in specialty training. Yes, it gives you the advantage that when you talk about, what you've done in your IMT and your specialty training interview, that you can be like, oh, I've done this and I've understood and I've wanted and I feel, whatever, but there's no bar on what you want to do. Okay. Beyond that, when you're ranking, please rank everything if you want to get in. But if you for sure know, let's say that if you got into Northern Ireland, you would not go to Northern Ireland, do not rank Northern Ireland, because if you do get Northern Ireland and then you decline your offer, you will not get another offer. That's it. You're done. No more offers. Okay. So don't take it. And don't put it on something that you would do if you aren't fully committed to moving to a location that you've ranked. And then beyond that, if you do decline an offer, it's not going to be harmful for your further applications. Each application has its own merit and it's a separate process. So, if it comes down to that, no, I wanted to start IMT in Manchester come August, but something's going on and I can't do IMT, I can't defer it, I can't push it down, I have to decline my IMT post, that's fine. You're well within your right to do so. It won't be any issue in the long run, but do it during the time where you're allowed to decline. Don't let it come to the point where after that 48-hour period has passed, you've essentially accepted the offer and then you decline. That doesn't look very nice. It's just like declining a job offer after you've already accepted and they've already started the process. GMC's Good Practice talks about this as well. Unless you have something that is really stopping you from starting, such as illness or some sort of family emergency, don't just, quit. Okay? So, just to kind of wrap up about preferences, once you've ranked what you wanted, you put from the top to the bottom what you want to do, keep your most likely option at the very top, where you say, if I get there, I'm going to go there, and then rank down. This is not something that can be done in one night. Do not think you can do it in one night. If you can, you're superhuman, because I'm at least one of those people where it's not that it's just time consuming, but you really want to think about all the locations. I used Mestly to see, what and where and how about the different locations and departments in the hospitals that I was interested in, that I had ranked, so I can get a clear picture. And also keep in mind about, if you have to change hospitals every year, how far apart each hospital is, because especially if you have a family, it's going to be kind of stressful going from one place to another place, and that's how your rotations work. All right, so after you've done that, you've submitted your preferences, you will get an email whether or not you've been found appointable. Remember, I talked about being appointable earlier. After your interview, when you get your raw interview score put in, and then they total it up with your application score. If you're found appointable after that, your ranking then comes into play, that you can get a preference based on what you've asked for and what you've stated. So you've gotten that, congrats. You've been found appointable, fantastic. Now you've gotten the preference and the offer that you wanted. You will get one offer. I know it says some places offers, but really it's just one offer. And this is the post that, you'll get an email. Congrats, you have been offered the post at such and such hospital with these rotations starting from this date. And you will either feel one of three things. You'll either be really happy because this is the exact place you wanted to go. You will feel kind of happy because you're not mad about this place, but your best friend didn't get in and you're just like, how can I be without my best friend? Or you're going to feel sad because this is not even anywhere in your top 20 and this was some place that you really didn't want to go, but you just put it on the list because you just wanted to get into IMT. Now, if you're really happy, fantastic. There's nothing for you to worry about. Get ready for your new job. 2, if you are not somewhere you want to be because your significant other, your partner, or whoever else, your family that you really want to be with is not in the same location, you have an option, thankfully, that they will let you kind of make sure this can be fixed. What you can do is you can upgrade your offer, and whoever else that you're trying to get with can also try and upgrade their offer or hold their offer depending on what works for the two of you. For instance, if you know that you've gotten a pretty good rank and your significant other has also gotten an all right rank, and if your rank is higher than their rank, it'll be easier for you to try and get into their hospital where they've gotten into rather than them trying to get into your hospital, if that makes sense. Because if they got a lower rank and you got this post with a higher rank, the likelihood of somebody dropping out from your hospital for them to come into and then being okay at that level of ranking, it's not that great. Not to say that it's impossible, but it's a little bit more difficult to assure that you would get in that way. So definitely think about if you have to go moving, you might have to step down rather than them stepping up. Now, if still after you've done this upgrade process, you've not managed to get the seat, you have another thing that you can do. You can email them. You can email IMT, and they're very helpful about it if you're not able to. But you need to explain your circumstances. Just because your best friend got into Manchester and you got into London, but you both want to be in Manchester, they may not entertain that as much as, oh, but my wife got into Manchester and I'm in London and we need to be together because we have 3 kids. So definitely keep that in mind. But another thing you can do is when you're ranking your preferences, try and rank the same places so that you have an increased likelihood of getting into the same places. Okay. So I think I've covered all the points about IMT, from eligibility to portfolio to interview and preferences. I'm going to quickly scan through here to see if there are any other questions. But in the meanwhile, if you guys do have some questions, go ahead and ask them on the right sidebar, and I'll try and answer as much as I can. Otherwise, if I don't, I will give our link for our messenger. You guys can message us there, and we will answer your question. But let me just kind of look through here. Okay. Is starting MRCP at least part 1 or more advisable before entering IMT? So it's a good idea if you can to clear part 1, mainly because you don't have to stress during your whole process of IMT about these 3 exams, because you need to clear all parts of MRCP preferably before the start date of your specialty training. Not to say if you don't, you can't get in, but it's just another added stress. You'd have to defer your start date. If you've already cleared part 1 and now it's 3 years, you at least have these 3 years to clear 2 exams rather than 3 years to clear 3 exams. So at least for the first year, you can kind of relax and adjust into the hospital rather than thinking in the back of your head, MRCP, MRCP, MRCP. Okay? Would you advise doing an observership or shadowing between plab 2 and GMC registration or a non-training job? Okay. So first and foremost, I just want to say that observerships or clinical attachments are not necessary to get a job. You can still get a job without them. But if you feel that you aren't super confident, or if you have time and you're in the UK, go do a clinical attachment. Most clinical attachments do cost money, so keep that in mind. There is an added expense unless you can somehow finagle a clinical attachment without it. And there may be things like indemnity or insurance that you need to make sure that you have because you are working in a clinical setting, even if you're not necessarily doing anything clinical. But it will be a good thing if you feel that you're not very confident, or you want to know how things work, or you want to see how things are. You can do it after plab 2 while you're waiting for your plab 2 result. You can do it after your GMC registration while you're applying for jobs. And even when you start a job, you can speak to the person who is doing your interview, or to your HR essentially, if you can have 1 or 2 months of shadowing. But that's up to you. But if you feel that that's what you need, people are very supportive. They're not going to be mad at you for doing that because it's their necks at the end of the day. Okay. Make sure I've not missed anything up top. 1 second. Okay. What about GP training? We will do another video about GP training. Don't worry. We're trying to get all the things. It's just the two of us, but we're going to get there. Don't worry, all right? But GP training is on our list. We're also going to be covering pediatrics pretty soon. We've already covered posts about surgical training, different other medical specialities, and training for obs and gynae. So if you've not already seen that, check that out. But we will definitely cover GP as well. Okay. Okay, answered that one. Okay. What do you think about RMO jobs? Do you mean working in a private hospital, or I'm not sure what you mean by that, or do you mean like SHO post? If you could clarify on that, I'll come back and answer that one. Which department do you recommend a person to work in for 1 year post internship? Okay, this is, I mean, subjective because every person is different. I did 6 months of A&E when I started out, mainly because I wanted to kind of get an idea of how everything works in the hospital, and A&E is the best place to do that. Don't do A&E if you cannot do really weird shift hours. Some of my shift hours, for example, I did 2 p.m. to midnight, 5 p.m. to 1 a.m. Nights weren't so bad. Nights were only 10 hours versus in acute medicine on call, the nights are 12 hours. But in A&E, there's never a time you're not working. Very rarely will there be no patients that you're sitting there and you're thinking about, oh yeah, I can take a break. I mean, you are allowed breaks, it's not like that, but it's very fast paced. Something's coming in, something's happening, you need to be there. There's going to be a call, patients come in, there's polytrauma, there's this, a child, something, you need to be there. So if you want to be in that kind of environment that you can see medical cases, you can see surgical cases, pediatric orthopedics, gynecological cases, if you want to see everything, start in A&E. You will get your competency signed off faster because you'll be able to do things. You will be very skilled in how to do cannulas. I mean, even if you know how to do a cannula from your home country, the way cannulas are here, the way certain mechanisms, certain tools are, they're different. They're a little bit different. They can be different. So don't think just because you're very good at it that, I mean, you're still going to be good at it, but you'll need to know, oh, is this the one I have to do for this? Is this the one I have to use for that? And you'll get that all done. But if you don't want to start off something as fast-paced as that, start off at least in acute medicine. Acute medicine is the second step after A&E, so the patients are still relatively unwell. They'll all be medical patients, so you won't see the full scope of everything, but you'll still have to do a lot of ongoing management, so you'll still be able to pick up on those things. If you kind of go into more focused specialties, like you start in respiratory or you start in gastro, you won't see as much because those patients already have been seen and stabilized in A&E, then they've been seen and stabilized in acute medicine, then they've come onto the ward. So clearing competencies are a little bit more difficult at that point because a lot of things have already been done. Again, I would say don't just take basic rota, try and do an on-call rota because it makes you very well-rounded and you see a lot of things. Even if you are in, you're starting in, let's say, respiratory medicine, when you're on call, you'll be working in the acute medicine department, so you can see a lot of things. But again, just my opinion. Is the salary sufficient to match the ILR requirement? Yes. End of story. Yes. All right. Does clearing MRCP Part 1 give an advantage into getting into IMT? So technically no, because it's considered a desirable criteria, not something that they mandate that you need to have before your start date. It definitely looks good because it's showing your commitment to your speciality, but don't think that, oh, if I have it and somebody else doesn't, then I'll get in over them, because that isn't necessarily true. There are a lot of other things that they look into. Do you have to decide your speciality as soon as you start IMT? No. There are a lot of people who I know who have starting IMT, from August, and they have no idea about the long run, and that's completely fine. This is why I say rotations are very important, that you make sure that the rotations that you get are very diverse. For instance, let me talk about my rotations. I will be going through geriatrics, gastro, oncology, acute medicine. There's one more. What else am I going through? Acute medicine, cardio, gastro, something else. I'm going through something else. There's at least 6 rotations that I'll be going through at 4 months each. Okay? And then I'll have the final year to kind of decide what else I want to do. rotation-wise, so that's good too, because maybe I'll want to do renal or respiratory or something else that I've not already done, so that by the time, I remember now, I'm in ITU, that's what it is. I'm going to be in intensive care as well, which is great because I think that's something that I really want to know and understand, because when you become a medical registrar, you might see a patient that you have to deal with who might need to go to ITU. So definitely knowing and understanding how to deal with those patients was something that I really wanted, and that's why I kind of chose the rotation that I chose. But definitely choose a really, really diverse rotation for that reason. Then you can figure out what you want to do. Okay? What about clinical gaps? Yes, what about clinical gaps? What gaps? I mean, it's a pretty vague question, but we do have a video talking about how to approach clinical gaps and breaks in clinical practice. If you just check on our YouTube page, you can see it there. But essentially, if you have a clinical gap, just to give a really brief, talk about it, it's not something that you should be totally worried about as long as you can explain. I know sometimes people have nothing more than I was sitting at home or I was applying for jobs, but that's fine. They just want to know what you were doing. And you can still show, and like I mentioned in the portfolio, by the trainings and everything that you do, your commitment and how you're trying to achieve different things and learn different things. So it's never going to be something that totally hampers you. Okay? So just to say, if there are no other questions, I really hope you guys got all the information that you needed to know about internal medicine training and what the eligibility criteria, portfolio, interview, and preferences, and how to rank. I hope with the little bit of experience that I've mentioned, I've inspired some of you all to try for IMT next year. And definitely, if you have any questions or concerns, or if you're wondering anything else, we are always available on our Facebook page or on our website. You can contact us. We have a little messenger there too that you can talk to us about. Let me just show you everything in case you've not seen it. Dun, dun, dun. So if you just check here, this is a little chat option that you can talk to us with. If you have any questions or concerns, you can view all the categories. You can like us on Facebook, which would be fantastic. And thank you guys again. We have crossed 20,000. You guys are awesome. And I'm really hoping that we are doing the things that you guys want us to do, and we're covering all the topics that you want to know about. You can see or follow us on Instagram and see all the lovely little photos that we take about our literal road to UK rather than our metaphorical one. And of course, subscribing to us on YouTube, because we're trying to bring more videos and more topics and talk about more things. And definitely, if you've not already subscribed to our newsletter, we're trying to make more targeted newsletters covering a lot of the topics that perhaps aren't already mentioned and that you can see in one place rather than having to scrounge around. But again, I also want to say we've come to 15,000 subscribers on our main website who have logged in and who are actual active users, which is also fantastic. And again, thank you so much, you guys, for doing this. But definitely, I want us, as everyone basically, to see how the staging goes on as we all make our roads to the UK. And it's not just us doing this, it's you guys too. Without you guys, we wouldn't be able to do what we're doing. And I want to thank you all again. And soon we will do another webinar about another topic, and we'll discuss all about that on our Facebook page. But again, thank you again for being with me today, and y'all are fantastic. I hope you have a wonderful weekend. If you're in the UK, Monday is a holiday, so it's a 3-day weekend. But yes, thank you, and hope to see you all soon.